Epilepsy is one of the most chronic neurological disorders that affects about 1% of the entire human population, which is about 500 to 100,000 people a year. Epilepsy occurs when there are recurrent seizures, which is caused by abnormal, synchronized, and high frequency neuronal discharges. In this presentation, I will be discussing how seizures can be prevented based on the effectiveness of electrically stimulating GABA in epileptogenic zones and area tempestus. These can be found in the prepiriform cortex and can be detected using the tools EEG and MRIs. GABA is short for gamma aminobutyric acid. GABA is the chief inhibitory neurotransmitter in the central nervous system that plays a huge role in reducing stress and regulating anxiety. GABA prevents overstimulation from excitatory neurotransmitters while regulating the piriform cortex is a unique brain region that underlies the mechanisms that produce olfactory experiences. EEG, also known as electroencephalography, and functional MRI and nuclear medicine imaging suggested the human piriform cortex plays a huge role in focal epilepsy. In a study conducted by 3 researchers, they found further functional imaging evidence which supports seizures in their late relapses. They found that there was maturation proepileptic tissue located in the temporal lobe. Proepileptic tissues are tissues that are not epileptogenic yet, but have the potential to become epileptogenic following a maturation time interval. Proepileptic tissues that have late maturation is the cause behind seizure reappearance. The 3 researchers performed the study on a 25-year-old man with history of partial seizures since he was about 10 years old. During his pre-surgical evaluations, they found out that he was having about 3 to 4 seizures about 2 to 3 times a month. They were able to assess this using the EEG and fMRI. The EEG monitoring revealed sharp wave activity in the right frontal temporal region, while the MRI found no findings suggesting right frontal lobe pathology. After 24 months post-operation, the patient was seizure-free and was allowed to go home and had normal routine EEGs. Shortly after the 24 months, unfortunately, the patient relapsed due to a withdrawal. This withdrawal removed 300 milligrams from the total daily dosage every 3 months the patient needed. Methods used to predict seizures can be monitored and analyzed through wave signals in EEG and MEG. Epilepsy can be prevented only through clear EEG readings, but it's still hard to detect since there aren't no stereotype pattern characteristics. In order to predict an epileptic seizure in a patient, researchers compiled a list of approaches. The EEG data examine epileptic seizure, non-seizure, and transition from non-seizure to seizure. In a study conducted by researchers, they selected 20 participants from neurological units from different hospitals. In order for these participants to be selected, they had to abide by a certain criterion, which follows. Researchers focus on the warning signals and triggering factors which can increase the risk of seizure development. There are 13 countermeasures that are developed through the diagnostic data of behavioral measures and seizure control. These 13 countermeasures are allowed to interrupt the initial stages of a seizure and avoid any provoking factors.
So what do you do if you find someone who's having a seizure? Number one, you want to stay calm. Assess the area, make sure that there's nothing that can cause injury to the person while they're having a seizure. You want to pay attention to the length of the seizure. You want to clear onlookers away. You don't want to clutter up the area with people looking and oogling and awing. You have to be sensitive to the person who's having the seizure as well. Don't put anything in the person's mouth. I know that's an old wives' tale to put a spoon or a wallet in their mouth. They will not swallow their tongue. They just need to ride out the seizure. You don't need to put anything in their mouth. It can cause more damage to shove something in there. You don't need to hold the person down. That can also cause more damage if you're fighting against them while they're shaking. Afterwards, you want to put them in the recovery position. Roll them over to their side. That way, if they start to vomit or any kind of saliva or any kind of fluids come out, it'll fall and they won't choke. So once they're recovered, you want to help them up, try to get them in a safe place. It may take them a while to fully get back to their normal self. If the seizure lasts for more than 5 minutes, you want to call 911. If the person suffering the seizure is pregnant or diabetic, you want to call 911. If it happens after a head blow or after ingesting any kind of poison or chemical, you want to call 911. If the person has another seizure within 24 hours, call 911. If the person is epileptic and has seizures often, they will wear a bracelet that says epileptic. This is part of their normal life. Be supportive, help them as much as you can, and be reassuring.